In most cases, having a baby is something you can safely do by yourself with little outside help. When the indoor plumbing stops working, unless you know how to fix it, you need a plumber, or you're going to have to find an outhouse and start schlepping water from a stream. If your car breaks down and you don't know cars, then you'll have to pay a mechanic or start walking everywhere. There are lots of things you just can't do yourself, but in most cases, having a baby is something you can do yourself. If that's true, then why watch this YouTube? Because if you watch it, you'll get a few helpful tips from an old expert midwife. Unless you were raised by wolves, you've been getting the false message all your life that you're likely to die or your baby's likely to die at birth. It's not true. Besides, I will show you how to prevent excess bleeding 100% of the time. The key to good birth outcomes is not a doctor, but attention to diet and exercise and 3 prenatal tests listed below. You need to not eat too much and walk an hour or 2 per day. 2 hours may seem unattainable, but it's a good goal to assure that you walk at least 1 hour. If you eat modestly and exercise such that you produce a baby under 7 pounds at full term, good birth outcomes are a sure thing, if the baby is alive when labor starts. Some are surprised to learn that the weight of the baby depends entirely on mom's diet and lifestyle. It does. Just like your weight depends entirely on calorie intake and output, so does the baby's. 3 prenatal tests that benefit the mother and baby are 1. Checking the blood type, 2. Checking if the baby is breech at 36 weeks, and 3. Diagnosing multiple pregnancy before the birth. Successful combination of an egg and a sperm is not a sure thing. Incorrect genetic combinations incompatible with life occur at 20% of conceptions. Due to these faulty genetic recombinations, 15% of recognized pregnancies miscarry before 12 weeks. If you include miscarriages before 4 weeks, in which the woman didn't know she was pregnant, 20% miscarry. An additional 1% die between 13 and 28 weeks, and an additional 1 in 1,000 die in the last 3 months. These fetuses' genetics are incompatible with life. Bed rest and progesterone cannot save them. It is important to know that not all bleeding, though, means miscarriage. 25% of pregnancies with perfect outcomes were accompanied by bleeding before 13 weeks of pregnancy. Usually the bleeding is light, but sometimes it includes red bleeding and even clots. An attended home birth with a formally trained, competent midwife is the ideal. I am opposed to women giving birth unattended because it's hard to resuscitate your own baby and hard to expediently deliver the placenta without being reminded to. But I'm also opposed to midwives and doctors turning women into profit machines by lying to them about dangers that don't exist. In the absence of genetic errors, malnutrition, violent beatings, head-on collisions, or lifting a bunch of washing machines or heavy boxes of books, at the end of 9 months, the baby comes out, midwife or no midwife. What's your blood type? If you're Rh negative and your partner's Rh positive or unknown, your baby's usually Rh positive and you need a shot of anti-D within a day or 2 after birth. You'll need to ask a medical doctor to write you a prescription for 300 micrograms of anti-D, and you'll need someone to give you the shot. You can buy anti-D online with a prescription. If you don't get the shot, there's about a 30% chance you'll be unable to have more children with an Rh positive partner. If you don't know your blood type, get it checked or ask your mother, or buy a blood type testing kit online on Amazon. During 30% of miscarriages and births, the mother gets exposed to the baby's blood during delivery. Before the invention of anti-D, Rh negative mothers exposed to Rh positive blood usually only had 1 baby because subsequent Rh positive fetuses were attacked by the mother's immune system. Anti-D prevents this. Rh mothers can have as many babies as they want if they get the shot. Check if the baby is head down at 36 plus 0 weeks. At 34 weeks, 50% of babies are breech and are still changing positions so often that their position is irrelevant. As the baby gets bigger, the head, which is the heaviest bit, stays down, especially in mothers who walk. At 37 weeks, 97% of babies are head down and 3% are breech. It's usually difficult to get an appointment for it to be turned quickly, so it's best to check at 36 weeks so you can make an appointment to get the baby turned at 37 weeks by a doctor in hospital with the assistance of ultrasound. Turning the baby before 37 weeks is a waste of time because the baby often turns back to breech. Natural healers don't use ultrasound, and there have been cases in which they kill the baby trying to turn it or lie to you that the baby's head down when it's not. Birth is much easier when the fetus is head down. When all breech births are delivered vaginally, including large babies, you get a perfectly healthy baby 90% of the time and a dead or brain-damaged newborn 10% of the time. There's a way around this. If the mother's normal height and eats a low-carb diet and walks a lot, so the baby's 2,500 grams at birth, then 100% of vaginal breech births result in perfect outcomes. The problem with breech babies is not the positions per se, but the combination of breech with a big baby. Today's diet and lack of walking results in half of babies having birth weights over 3 kg 400. Breech only runs into trouble with these bigger babies or a small stature woman. Large head babies take time to get through the pelvis because the skull bones sometimes have to mold over hours of pushing to get the skull in a shape that it can come out. The head is designed to make its way out regardless of size if the fetus is head first. But when the head comes out last, there's no time for molding. In breech birth, after the body's out, the cord stops pulsing by 1 minute, and if the baby's head is not out in 5 minutes, the baby dies from lack of oxygen. Molding the fetal skull can take hours, not 5 minutes. Breech birth is fine if the head is small and delivery of the head follows the body within a minute or two. Delivering breech into hot, body temperature water might give you an extra minute of the cord providing oxygen after the body has delivered, but there's not enough time to change the shape of the fetal head. Unless you used IVF to get pregnant, the most accurate due date is an 8-week ultrasound. At 8 weeks, ultrasound gives a more accurate due date than your last menstrual period. But after 8 weeks, the last period gives the closest approximation of when the baby's due. Modern man loves to plan stuff. If you don't do an early ultrasound between 8 and 9 weeks, you won't know exactly when you're due. Ultrasounds after 10 weeks are not that accurate for dating because after 8 weeks, every fetus is slightly different size and has a different growth rate. Not doing 8-week ultrasounds for dating eliminates the worry about going post-dates. Inductions for post-dates don't improve outcomes, and worrying sends worry transmitters to your undeveloped fetal brain. However, having accurate dating will allow you to know when you're 36 weeks to check if the baby's breech and needs turning. But that's only a problem if you have a large fetus, which is going to be over 2,800 at delivery, or if you're very short. If twin B is delivered within 15 minutes of twin A, then everything goes fine. If twin B is delivered more than 15 minutes after twin A, then in 75% of cases, everything is fine, and in 25% of cases, twin B will be dead or brain damaged. But if you practice expedient delivery of the placenta to prevent hemorrhage, then if there are multiple babies, you'll deliver twins within 15 minutes and never have a problem with undiagnosed twins. Twins are small and easy to deliver. The problem with twin B is because in 25% of cases, both placentas separate from the uterus at the time of the birth of twin A. Premature babies need to deliver in hospital. But if the woman eats enough protein and healthy food, multiple pregnancies do not deliver prematurely. My dream is to deliver triplets at home, but only if the woman agrees to have it videoed and put on YouTube, because there are no cases of triplets born at home on YouTube. I think posting authentic videos of cases of supposedly super high-risk births is a great way to convince women how simple birth really is. So there you have it. I've provided 3 prenatal tests that improve birth outcomes. Quality research proves prenatal tests such as the sugar test, routine ultrasound, organ scan, amniotic fluid index, biophysical profile, GBS cultures, and CTG monitoring do not improve birth outcomes, and they increase cesarean birth rates, which cause maternal death and morbidity. You want to know if you're anemic? If you don't work and you feel exhausted, you probably are. Take some iron. Improve your diet. Know that everything has side effects. Iron pills block the absorption of magnesium. The best thing is to get your vitamins and minerals from food. Overeating is bad for you. You're not eating for 2. The first 3 months, the baby is microscopic and no woman should gain any weight. Losing weight is not a problem. If you're normal weight, aim to gain 10 pounds in the last 6 months for a singleton baby. If you're obese, aim to lose weight during pregnancy. From 12 weeks of pregnancy on, your diet needs to include 50 grams of daily complete protein. 50 grams is 2 cans of tuna fish or 400 grams of cottage cheese. Quality research shows very clearly that what's healthy in tuna fish, like the protein and the omega-3, outweighs any risks of minor impurities that might be in the tuna. You want a big baby? That's fine. Just know the whole reason you'll need a doctor to deliver you is because of your choice to overeat in pregnancy, resulting in a 9-pound baby instead of a 6-pound baby. A healthy newborn can weigh 6 pounds, the placenta 1 pound, extra liter of blood 2 pounds, extra breast tissue, less than half a pound. The frequently repeated phrase that you need to gain weight in pregnancy for breastfeeding makes no sense in our time. That was true if people starved during the winter. Today you can eat the food you need for breastfeeding when you're breastfeeding. Extra weight gain and lack of activity is what causes hemorrhoids, varicose veins, stretch marks, backache, fatigue, indigestion, and shortness of breath. Have every morsel that you eat be designed to be nutrient-rich, not calorie-rich. 1% of babies are born with a heartbeat, but either don't breathe spontaneously or stop breathing around 5 minutes after birth. If not stimulated to breathe, they turn white and die. Sometimes the mother blocks up the newborn's nose with her breast, making it impossible for the newborn to breathe. The midwife's job is to make sure babies breathe and keep breathing. Only the color of the body is important to observe. The face may be purple from the pressure on it during birth. Massaging the newborn's back or holding it with 2 hands and pretending to drop it is usually enough to get it to breathe. If not, breathing air into the mouth of the baby once or twice will usually get it breathing. Resuscitation has to be expedient because with every second that passes, the brain becomes more deoxygenated, harder to resuscitate. Brain damage and death occur within minutes. How many minutes? Noticeable brain damage is certain, somewhere between 5 and 8 minutes without oxygen. The cord stops supplying oxygen within the first minute. The hardest resuscitation occurs among the over 4-kilo breech or cases of shoulder dystocia causing the newborn to be born dead and not breathing, without a heartbeat or breathing. This requires CPR. If massaging the heart from outside of the chest is unsuccessful, very strong mouth-to-mouth puffing stimulates the heart from inside while flushing the lungs with fresh air containing 18% oxygen, the perfect amount for human life. Generally, it's dangerous to blow very strongly into newborn lungs because they can burst. But when a baby is recently dead and needs resuscitation, risking a lung puncture is worth saving the newborn. 1% of babies don't breathe spontaneously or breathe and then stop breathing after 5 minutes and die if no one resuscitates it. If the placenta is delivered more than 5 minutes after the birth, 5% of women lose over a third of their blood supply. So the second job of the midwife, in addition to resuscitation, is to prevent postpartum hemorrhage by getting the woman into a squat at exactly 2 minutes after the birth and getting her to push until the placenta is delivered. If the placenta embeds in the uterus, it cannot deliver normally. This happens about 1 in 2,000 births where the person is not after a previous cesarean. Removing it is pretty easy, but you can't do it yourself. Someone has to reach in and deliver the placenta, or you can go to the hospital and get it done there. Shoulder dystocia like breech is another problem unique to big babies over 3.5 kilo. Shoulder dystocia never happens if the birth weight is 2.5 kilo. It only starts at 3.5 kilo and usually happens if the baby is 4 kilo or more. And the midwife has to act very quickly or the shoulder can get stuck under the pubic bone and the baby could die. Here's my last tip. There's something called false rupture of membranes. The sac has 2 layers. The inner sac is the stronger one. Of 5% of cases in which the woman is sure her water broke, only the outer sac broke, which is irrelevant because the baby's still enclosed in a protective sac. If the outer one breaks and amniotic fluid comes out for an hour or maybe even 8 hours, but then completely stops dripping, this means only the outer sac broke and she doesn't have ruptured membranes. The sac is intact and labor might not happen for another week. 50% of birthing women who deliver in hospital get IV Pitocin and artificial rupture of membranes to make labor faster, causing 1 in 15,000 women to die from amniotic fluid embolism. At home, without Pitocin and without artificial rupture of membranes, 1 woman in every million will die of amniotic fluid embolism, usually upon the water breaking at the start of labor, typically in women over 40 who have health problems.